caring for a client on a mechanical ventilator, the high pressure alarm on the ventilator sounds. The nurse suspects that the most likely to cause of the alarm is which of the following? 1. A disconnection of the ventilator tubing. 2. An excreted client respiratory effort. 3. Generation of extreme negative pressure by the client. 4. Accumulation of respiratory secretion. The correct answer is 9. Accumulation of respiratory secretion. 10. The nurse is monitoring the respiratory status of a client following insertion of a tracheostomy. The nurse understands that oxygen saturation measurement obtained by the pulse oximetry may be inaccurate if the client has which of the following coexisting problems? 1. Hypotension. 2. Fever. 3. Respiratory failure. 4. Epilepsy. The correct answer is 1. Hypotension. 11. A physician writes an order to begin to wean the client from the mechanical ventilator by use of intermittent moderatory ventilator. Intermittent moderatory ventilator, the nurse determines the process of weaning occur will by 1. Gradually decreasing the respiratory rate on the ventilator until the client assumes work of breathing. 2. Providing pressure support to decrease the workload of breathing and increase the client's ability to initiate spontaneous breathing effect. 3. Attaching TPs to the ventilator and providing supplemental oxygen that is 10% higher than the ventilator setting. 4. Removing the ventilator from the client and closely monitor client's ability to breathe spontaneously for a predetermined amount of time. The correct answer is 1. Gradually decreasing the respiratory rate and the ventilator until the client assumes the working of breath. 12. A nurse is caring for a client who had Montag skin test implanted 48 hours ago. On admission to the nursing unit, the nurse reads the test result positive. Which action by nurse has the highest priority? 1. Contact the physician. 2. Call the radiology department and the chest radiography to be done. 3. Document the finding in the client's record. 4. Call the employee health service department. The correct answer is 1. Contact the physician. 13. A nurse is caring for a client on the mechanical ventilator. The low pressure alarm sounds. The nurse suspects that which of the following is cause of this alarm? 1. A tubing obstruction arcing. 2. The accumulation of secretions. 3. Condensation of water in the ventilator tubing. 4. Disconnection of the ventilator tubing. The correct answer is 4. Disconnection of the ventilator tubing. 14. The nurse is monitoring the function of a client chest tube that is attached to fluid drainage system. The nurse notes that the fluid in the water seal chamber rises with inspiration or falls with expiration. The nurse interprets that 1. The client has residual pneumothorax. 2. The system is patient. 3. The suction should be added to the system. The system has leak. The correct answer is 2. The system is patent. 15. A nurse is planning to wean a client from ventilator by the use of TPs. Which of the following would not be a component of the plan of care with this type of weaning process? 1. The client is removed from the mechanical ventilator for a short period of time. 2. The TPs is connected to the client artificial airway. 3. Supplemental oxygen is provided through the TPs for the fraction of inspired oxygen that is 10 higher than the ventilator setting. 4. The respiratory rate on the ventilator is decreased gradually until the client achieves all of the work breathing. The correct answer is 4. The respiratory rate on the ventilator decreased gradually until the client achieves all of the work breathing.